The current landscape of the U.S. healthcare system continues to be dominated by the intertwined challenges of escalating costs and persistent accessibility gaps. National health expenditures reached approximately $4.9 trillion in 2023, representing about 17.6% of the GDP, a figure significantly higher than other developed nations, yet not consistently yielding superior health outcomes. A major driver of these costs remains prescription drugs, with spending growing faster than other sectors in recent years. Administrative complexities and the prevailing fee-for-service model also contribute to inefficiencies. For individuals, this translates into rising out-of-pocket costs, with average per capita out-of-pocket spending at $1,504 in 2023, excluding premiums. This financial burden is leading to a concerning trend. A growing number of Americans, especially those with lower incomes and from minority groups, report being cost-desperate, unable to afford needed care or medicine. On the accessibility front, while the Affordable Care Act has expanded coverage, millions still lack insurance, and even those with coverage face barriers like high deductibles and narrow networks. Medicaid enrollment, for instance, has recently seen declines due to eligibility redeterminations. Provider shortages, particularly in nursing and specialty care, further strain the system, leading to longer wait times and potential compromises in care quality. The system is also grappling with increasing demand from an aging population and a significant rise in behavioral health service utilization. Hospitals continue to face financial pressures from rising labor and supply chain costs, and in some cases, inadequate reimbursement from public programs like Medicare. In essence, the U.S. healthcare system remains a complex, high-spending, yet often inequitable landscape, where financial strain on both patients and providers continues to be a central concern. The looming crisis within the U.S. healthcare system poses severe and multifaceted impacts on individuals, extending far beyond mere financial strain. One of the most immediate and devastating consequences is medical debt. A significant portion of the population, even those with insurance, struggles to cover high deductibles, co-pays, and services not fully reimbursed. Studies indicate that nearly 1 in 4 U.S. adults or a family member experienced problems paying for healthcare in the past year, and around 41% reported medical or dental bill debt in 2022. This debt often leads to bankruptcy, housing instability, and credit score damage, trapping individuals in a cycle of financial distress. Beyond the immediate financial toll, the crisis directly affects access to necessary care. Cost concerns lead many to skip or postpone vital medical treatments, prescription refills, and even preventive care. For instance, approximately 1/3 of adults reported delaying or forgoing needed health care due to cost in the past 12 months. This deferral of care can exacerbate existing health conditions, lead to preventable complications, and ultimately result in poorer long-term health outcomes. Uninsured adults and those with lower incomes are disproportionately affected, highlighting stark inequities in the system. Furthermore, the burden of care extends to family caregivers. A recent 2025 report revealed that 63 million Americans are providing complex care for loved ones, often experiencing significant financial strain, poor health, and social isolation themselves. This invisible labor further underscores the systemic pressure on individuals and families. The crisis also impacts individuals' mental and emotional well-being. The constant worry about affording care, the stress of navigating a complex system, and the fear of medical emergencies can contribute to increased anxiety, depression, and a diminished quality of life. The current landscape means that for many, health decisions are not solely based on medical need, but are heavily dictated by financial capacity, creating a profound and deeply personal crisis for millions across the nation. Addressing the multifaceted crisis in the U.S. healthcare system requires a comprehensive approach, focusing on both cost containment and improved access. One critical solution lies in a significant shift towards value-based care models. Instead of the current fee-for-service system that incentivizes quantity, value-based care rewards providers for positive patient outcomes, efficiency, and coordinated care. This encourages preventive care, chronic disease management, and reduced unnecessary procedures, ultimately lowering costs and improving health. Price transparency is another vital element. While current efforts have faced challenges, making healthcare costs clear and comparable for consumers and purchasers can foster competition among providers and empower patients to make informed decisions. This requires standardized, accessible data on pricing for services and prescription drugs. To tackle the escalating cost of medications, negotiating drug prices at a national level, similar to practices in other developed countries, could significantly reduce pharmaceutical expenditures. Incentivizing generic drug development and increasing market competition are also key. Improving accessibility involves expanding coverage, potentially through universal healthcare models, or by strengthening and expanding existing programs like Medicaid and Medicare. Addressing healthcare workforce shortages is also crucial, especially in primary care and mental health. Through increased training programs, incentives for practicing in underserved areas, and optimizing the roles of non-physician practitioners. Finally, a greater emphasis on preventive care and public health initiatives can reduce the burden of chronic diseases, which account for a large portion of healthcare spending. Investing in community health programs and addressing social determinants of health, factors like housing, nutrition, and education, can improve overall population health and reduce the need for expensive acute care. Implementing these solutions, while complex, is essential for a more equitable and sustainable healthcare future. The U.S. healthcare system's challenges demand immediate and collective action. We cannot afford to passively observe rising costs and dwindling access erode the well-being of our communities. As individuals, your voice matters. Engage with elected officials, sharing personal stories of how healthcare costs or access barriers have affected you or your loved ones. Support organizations actively advocating for healthcare reform, whether through volunteering, donations, or simply amplifying their message. Stay informed about proposed solutions like value-based care, price transparency, and drug price negotiation. Understand how these changes could impact your care and advocate for policies that prioritize affordability, accessibility, and quality. The future of healthcare depends on our collective will to demand a system that serves everyone. Let's transform this looming crisis into an opportunity for a healthier, more equitable future for all Americans. Act now.